the member from Portland Western, the Minister of Energy and Telecommunications, for a comprehensive, action-oriented presentation full of what has been done and more good things on the horizon. We will now turn to the member from St. Andrew South Western.
To the honorable members of this. Oh.
Press shadow. Yeah.
Oh. To the honorable members of this House, I am guided by the enduring truth of Proverbs 19:17. Whoever is kind to the poor lends to the Lord, and he will reward them for what they have done. I had in my presentation a whole page and a half of that. If you are part of the team who has helped me be here doing what I'm doing, I say thank you. I hope you understand why I do not have the time to call you by name today. So I want to start, first of all, with the historical foundations of social protection in Jamaica. Jamaica's social protection framework owes its most enduring advances to successive PNP governments, which have consistently prioritized the poorest and the most vulnerable, delivering economic security, health safeguards, education access, digital inclusion, and justice reforms that traditional definitions often overlook. The foundations began in the 1960s, yes, under a JP administration with the NIS and the new secondary schools. But it was the PNP leadership of the 1970s under Michael Joshua Manley that revolutionized protection for the needy. The Minimum Wage Act, the National Housing Trust, Employment Termination and Redundancy Payments Act, Equal Pay for Equal Work, Maternity Leave with Pay, and most crucially, free secondary and university education. In terms of the dignity that many of us claim, it is because no bastard not there again. These policies shattered barriers of poverty for generations of Jamaicans, providing the catalyst for national progress that endures today. The PNP government pressed forward in the 1990s and 2000 with targeted lifelines like PATH, the National Health Fund, the National Health Card, the drug window for the elderly, directly shielding vulnerable families from destitution and illness. At the time of its introduction in 2014, PATH was seen as a landmark framework, articulating a comprehensive commitment to addressing poverty, inequality, and vulnerability. And it stood as the first strategy of its kind in the Caribbean, positioning Jamaica as a regional leader in the design and articulation of social protection systems. The then Minister of Finance, Dr. Peter Phillips, described this strategy as path-breaking, reflecting the collective efforts of the PIOJ, the Ministry of Labour, international partners, and a wide cross-section of stakeholders. Visionary, though underappreciated, is the Universal Access Fund under the member from East Kingston and Port Royal, who brought Wi-Fi to the poorest communities, empowering them with essential connectivity. In a modern triumph, the 2015 Dangerous Drugs Amendment Act, spearheaded by the then Minister of Justice, Minister Mark Golding at the time, protected thousands of low-income Jamaicans from criminalization, from being framed, from incarceration for small-scale ganja use, including sacramental rights. By freeing courts from this backlog, it ensured that the resources of the justice system reached those who needed it most. What is pellucidly clear here is that successive PNP administrations have proven indispensable, forging a robust safety net that uplifts the vulnerable and strengthens Jamaica. And it is against that backdrop that I make my sectoral presentation today. As I speak, I have to say that the pace of implementation of PATH has not quite kept up with the ambition of its framework. We have yet to achieve the truly integrated all-of-government approach that has long been espoused. As a result, many vulnerable Jamaicans continue to fall through the cracks, exposed to economic and social shocks without adequate support. You know, I look at the passage of Hurricane Melissa on October 28th. It represented a critical stress test for the country's social protection architecture. For many Jamaicans, it called into question not only the government's capacity, but also its commitment to inclusive, people-centered development. Regrettably, relief and recovery efforts have not consistently reflected the values of dignity, transparency, resilience, and inclusivity that should underpin such interventions. Many vulnerable citizens have been left disillusioned, with some nearing the point of disengagement from the very systems designed to support them. There is a growing perception among Jamaicans that the benefits of this so-called prosperity have not been equitably distributed, and that significant segments of the population remain excluded. It was prosperity for the few. You know, for years, the conversation has centered around social safety nets. However, since 2025, we have been talking now about social protection floors as a right-based approach to the realization of economic, social, and cultural rights aimed at reducing poverty and inequality. And so that's the context in which I'm speaking here. Now, social protection floors represent a nationally defined set of basic guarantees, including access to essential healthcare, education, income security, alongside targeted investments in poverty eradication, social inclusion, particularly for persons with disabilities, for seniors, and other vulnerable populations. I'm not here saying that this is going to happen overnight, but there must be clear, measurable progress. Jamaicans must be convinced that policies and programs are being designed and implemented to protect them from poverty, vulnerability, and exclusion. So I spoke about PATH earlier, and I say that it has played an important role in improving school attendance. And I know that the spokesperson on education might tell me to be careful about the data that is presented to us. Unfortunately, I don't have any other source, so I'm going to quote it. And so what the data says is that because there is that 85% conditionality, meaning that persons have to be in school for 85% of the time to remain on the program, it means that the attendance of children on path is way above the attendance of children who are not on path. But here is the problem. The problem is that attendance does not equate to learning outcomes. It doesn't. While secondary education is nominally free, the associated costs continue to present substantial barriers for many families. Many of you as MPs would hear the stories from children and parents about how they are shamed and their names are called, they are sent under trees, they are treated differently because they cannot pay. Different lines. And in some sense, we understand the need of these schools to collect the fees because that is what they use to actually keep it going and provide services. So what that means is that we have to find a way to ensure that these children and their families are not seen as being different, but that there is some protection to allow them to have that secondary education. The school feeding program is a good program, but it needs to be reimagined to ensure that it is cost-effective and yet nutritious. I am not sure if Nutribullet in 2026 is the most nutritious meal that we could get. I'm not. Yeah? The current allocation per student is simply ridiculous. Just this morning, as I was preparing to come to go on the road for Read Across Jamaica Day, I heard the news that Greater Portmore Primary advised of its painful decision to suspend its school feeding program. You know why? Inadequate funding. Lack of funding. Can you imagine what is going to happen to some of those children coming to school without their meals, or hiding in a corner so persons don't recognize what it is they've had to take to school to eat for lunch? This can't be the Jamaica that we sit here proudly that we represent and we are building in 2026. Nah, something else, something has to change. And so the opposition is calling for a decisive shift towards implementation, which includes integrating diagnostic assessments, remedial support into path conditionalities, strengthening inclusive education system, and providing targeted financial assistance to reduce the burden on vulnerable families. And I say it already, the meals, yeah? We have to look at it differently. We also have the experience of our faith-based organization helping with education. And so we know that community-based governance structures should be strengthened to ensure participatory accountability and local ownership of educational outcomes. We want to see more of that. I want to talk a little bit about healthcare, because healthcare must constitute a fundamental pillar of Jamaica's protection framework. Yeah? The current structure of this so-called free healthcare continues to fall short of its intended purpose. And I'm not here to make the presentation that the spokesperson on health will, but I do know that in practice, many patients are still required to procure basic amenities and incur out-of-pocket expenses for routine services. Routine services. We know that the public health system continues to face persistent gaps in infrastructure, equipment, and staffing, all of which directly affect the quality and accessibility of patient care. And I know that every single one of us in here as members of parliament have heard the horror stories of members of our family or members of the community who have gone to the hospitals and what that has meant. I wouldn't even like to tell you of the 3 persons who I am dealing with who currently have cancer and how difficult it has been for them. That's for another day. The shameful reality that we have, can you imagine that surgeries have to be postponed because of a lack of repairs to central air conditioning unit? What is that? But that was the case at the Bustamante Children's Hospital. And the truth is that the Jamaica Medical Doctors Association also said something similar when they said that the UHWI, the core barrier to reliable service delivery lies in systemic defects, including staff shortages, compensation and compensation breaches, more so than even funding itself. And the truth is that this reality disproportionately affects the most vulnerable, placing lives and livelihoods at risk. It is simply not acceptable. You know, Hurricane Melissa exposed the long-standing structural weaknesses within our healthcare infrastructure. In that moment of crisis, the contribution of volunteers, both local and international, proved invaluable. They delivered critical medical services to rural, remote, and underserved communities, undoubtedly preserving lives at a time of urgent need. On behalf of all Jamaicans, I once again, as others have done before, want to say a big thank you. However, I am clear that volunteerism is not a substitute for a resilient and adequately resourced national system. The government's level of preparedness in the aftermath of the hurricane was simply inadequate. There's no other word for it. As the reconstruction efforts continue, there must be a deliberate shift toward building resilient healthcare infrastructure capable of withstanding future climate-related events. Further concerns arise with the abrupt departure of the Cubans. I would not like to tell you the number of individuals who right now are uncertain and distressed, yes, in light of the challenges about where they go for health care. And then the truth is, we have to look at what is happening around us, because there are international models that demonstrate what the possibilities are for a universal healthcare guarantee that ensure equitable, climate-resilient access to essential services. We have Costa Rica, where they have a social security system that provides a universal basic package covering primary care, hospitalization, and medication for about 90% of its population. Barbados has a national health insurance arrangement that supports comprehensive primary and preventive care. Chile has clearly defined service guarantees for high burden conditions supported by investments in resilient systems. Others are doing it, we can do it. These are just some examples that I've put there to say that that is where we really need to go, and we need to begin to look at it seriously. Decent work and livable wages. Without this, social protection is incomplete. Decent work and livable wages determine whether families can eat, send their children to school, recover after disasters, or contribute productively to national rebuilding. Jamaica cannot achieve a durable social protection floor without legal certainty on wages, workplace safety, social protections, and recognition of service. The government's decision to increase the minimum wage to $17,000 a week, up from $16,000 a week, is way short of that campaign commitment for $32,000 a week. And it is nowhere near that livable wage that we should be talking about. For years, I want to talk about the security guard. For years, we have been talking and calling for a joint industrial council for the industrial security industry, and we want to do that again. The government must initiate these discussions and provide a structured pathway to protect these workers from falling into poverty after years of service. You know, many of them are either close to retirement or past the age of retirement. What has been happening is that they have been forced to enter into new contracts, so they are treated as new recruits, losing all the years of service and with no benefit to carry. We must be concerned about that. And then let's talk about the OSH bill, which was intended to replace the outdated Factories Act of 1943. It was first tabled in Parliament in 2017. A lot of review, still not passed. We have heard the recent promises of the minister, yes, that it will be passed shortly. But promises without law leave workers exposed. And as Jamaicans, we know that promise is comfort to a fool. What is needed is statutory funded systems that deliver livable wages, safe working conditions, and enforceable protections. In December 2025, the Red Cross reports that we had 156,000 homes that were damaged and in need of repair, with approximately 90 families directly affected. Last week, the minister said that 114,000, yes, 156,000. And 90,000 families, yes, directly affected. Last week, the minister indicated that 114,000 households were assessed. But I want to talk a little bit about that. Because honestly, the optimism and glee with which the minister speaks does not accord with the lived experience of the majority of individuals who are still reeling from the devastation of Hurricane Melissa. Many of them have not yet been assessed. They're not even so sure how to get assessed. Yes? Others have been assessed, but are still not aware of their status. Yeah? And then again, others have been sent their information, and it is still a quandary about exactly where they fall. It seems to me that the system was not built for transparency, nor from accountability, and that is a big problem. When individuals go to the parish offices, the woes that they tell, yeah, they say that the information that they collected and put in there from the workers, it has changed. Yes? Personal geotagging is a problem because there are issues with how the houses have been geotagged, which takes them out of the system completely. Community names being mismatched, locations being incorrectly recorded. Data handling issues have led to missing or incorrect information, including phone numbers, TRN, the level of damage, even though this information was provided during the assessments and uploaded. In some cases, payments marked processed later appear cancelled. Yeah? There are also reports that damage levels recorded during the assessments have been altered after the fact, reducing entitlements for affected households. And this is not dumpy stories. I'm talking to individuals and I'm placing there because I believe that they are that important. I believe that there must be immediate corrective action. We need to see a fully operational online portal and toll-free hotline. So issues the issuing of verifiable assessment receipts or control numbers. When assessment is done, nobody who was assessed has anything to prove that they were assessed. Somebody came, talked to them, and left. And now it is my word against your word, whether or not you were assessed. The inefficiencies that prolong the suffering is just simply not administrative failure. It is a failure of responsibility. And I think that that needs to be owned. I want to talk a little bit here now about, about dignity, inclusivity, and identity. Social protection floors are not just about survival. They are also about dignity, inclusivity, and identity. Dignity requires that support be delivered in a manner that respects individuals, protects their privacy, and avoids unnecessary hardship and humiliation. Inclusivity requires the full and effective implementation of the Disabilities Act. Identity requires that policies recognize and respect the lived realities of all Jamaicans. Consider Rastafari a pillar of our national identity, celebrated globally through music, philanthropy, and culture. Yet our laws treat it simply as a religion, overlooking its holistic essence and how that then influences spiritual sacraments, economic livelihood, natural health practices, and environmental stewardship. Yeah? Current protections do not go far enough. Yes, the amendments to the Dangerous Drug Act offer just partial relief, but without explicit constitutional recognition. We need to go further. I also want to talk a little bit about what this dignity and inclusivity means. We are descendants of Nanny of the Maroons. We are descendants of Paul Bogle. We are descendants of Sam Sharp. What that means is that many of us who are sitting in these hallowed chambers, in this house, are only here because there were individuals who dared to buck the system. Because there were individuals who said, I will not be treated as a non-entity. Because there were individuals who said, you cannot strip me of my dignity and my integrity. I believe that those of us who have the privilege to be sent in this house deserve to present to the people of Jamaica the same courage of our ancestors. We cannot sit in the chambers and be treated like children. We cannot sit in the chambers where persons use the bully pulpit to say just about anything they want, and we have to sit silently. As educators, we know that we teach children differently from adults. We talk about pedagogy and andragogy. Because adults are self-directed learners. Because adults want their experiences to be validated in how we deal with them. This is no different in the chamber. No one gets to come into the chamber regardless of who you are, to pontificate and to scold the rest of us without taking responsibility for your own lack of decorum and disrespectful behavior. This, for me, is fundamental. It is about who we are and it's about our identity. I say to my boys, I say to my nieces, when you are in a relationship, allow no one to strip you of your dignity. Allow no one to make you feel as if you are not worthy. I am duty-bound, therefore, to live what I preach and to be an example to those that I have been saying, do not allow others to trample over you. I am very clear in my mind that every action has consequences. We are leaders. Choice making is what we do every day. We take decisions and we bear the consequences. And so I say to this august body and to my colleagues, I am willing to cooperate with anyone who is willing to treat me as a human being. willing to play my part. Granted, I have never been a submissive female. It's too late for me to be that now. It's too late for me to be that now. So you will not get a submissive Angela in the chambers. No. However, I respect my colleagues. But there's a line I draw. If I come before you and every day you disrespect me, them say one day the bucket bottom I go drop out. And when it drops out, and I stand here today very, very clear, when it drops out, those who have the authority to punish, go ahead. Go ahead. History will absolve. I do it not just for myself. I do it for those others who will come behind us and will remember that in this house we are all to be treated equally. That in this house, when we have certain positions, we put aside our political partisanship. And if we can't, we step aside from the position that requires it. And so, I am very clear. I have dropped a lot of what I had prepared to speak today because I believe that this is important. I believe this goes to the heart of our democracy. Democracy is not just about you wielding a sword. It is also about how you reach across the aisle and make accommodations and come to decisions to the benefit of all. I am tired of sitting here, pressing my mic, asking to be to say something. And you don't have even the decency of listening and then saying no. None of us here, none is clairvoyant. None of you live in my head. And therefore, even though you think you know me well, you do not know what I am going to say when I press my mic. Give me the courtesy. Accord me the respect as an elected member of this house to be heard. You then have the opportunity to determine whether it is okay or not for me to go ahead. I stand here as a representative of the people of Southwest Pennsylvania. I come from the traditions of Portia Lucretia. I come from Vincent Brown, who is still alive at 100 and would rue the day if he saw me in a position where I sat quietly and took disrespect. Never. Never. And so I'm hoping, as I close, that this will be a moment on which we reflect, all of us, not just some, so that we leave the lack of decorum, whether it's from that chair or otherwise. We leave the disrespectful behavior, whether it is from the speaker's chair or otherwise. The rabid partisanship, whether it is from the speaker's chair or otherwise. It is one thing to say it and you're not mic'd. But when you stand to speak and to represent, then you have to draw the line somewhere. I am hoping that this will lead to a new day in the parliament. I want to see it because I would like to be able to sit comfortably, to banter with my colleagues here and on the other side, to disagree with a laughter still on my face, and to agree respectfully, and to agree when that is what it requires. Thank you.
Worry I got.
House Leader. House Leader. Mr. Speaker, we have just heard from the member from St. Andrew Southwestern. We will now ask for the recommittal of the, well, firstly, for the suspension of the sectoral debate and for the recommittal of the agenda items. The request is on the floor for the suspension of sectoral debate. Those in favor? Those against, the ayes have it. We will now have the recommittal to the agenda.